today's workshop, when you see something, say something, is Michigan State University School of Medicine is providing the continuing medical education credits for this. The reason we do that, beyond even physicians or nurses or public health folks receiving credits, is so you understand that we have some scrutiny and oversight to all the content that we put out. I am not a scientist or a physician. I'm just a squeaky wheel that wants less cancer like the rest of the world. And so we are very careful on fact checking and voices and expertise. And so I just wanted you to be aware of those details. This program today, we've done a few of these workshops, is really geared for health professionals, health, not as in healthcare, but personal health, like hairdresser or manicurist or massage therapist or tattoo artist. Those folks, for when they see a change or they see something, that they say something. And so this video today will go to several audiences, and you're really our studio audience for the sake of the tape, and we're glad you're here. But we are going to start this program off with a video from a board member of ours, Yvette Bowser, an African American woman, professional writer, producer, founder of and creator of shows like Living Single and some of these kinds of shows from the 90s. She has been a great supporter to less cancer and a great advocate, and she's been very helpful in waving a flag for people with black and brown skin and melanoma, because it's so hard to diagnose. So sometimes it's under a fingernail bed, or it's under, the palm of your hand, or at the bottom of your foot, or in places like that. So Eric, if it's okay, if we could start with Yvette's tape.
Hi, I'm Yvette Bowser, the creator of Living Single and a member of the board of Less Cancer. As we all know, some of the people we trust the most work in personal care. You're our hairstylists, our nail technicians, our barbers, people we see on the regular and are super comfortable with. And while you're not healthcare providers, you are often the first to notice if someone's skin looks different. And here's the thing. People with black and brown skin do get skin cancer. It's just unfortunately often detected later because it's harder to see. A dark streak under a nail, a foot sore that doesn't heal, a patch of skin that keeps changing color. So if you see something, gently say something and encourage your clients to get it checked out, because you never know. You might be the reason someone catches something early. You might be the reason someone gets to live a longer, healthier life.
She's a great person to have on our board and has been so helpful in sending the message. Today, we have joining us Caleb. Where are you? Is Caleb here?
Hi, Bill. Here I am.
There. Hey, Caleb. So Caleb is a friend of Less Cancers. He is a nurse practitioner. He just got some other, what did you just get? What did you just graduate with or receive? What was that program you just finished?
I just graduated from a level 1 trauma center acute care surgery fellowship for advanced practice providers.
Good. That's great. That is great. So just to give these folks in the audience and at home an idea of the Closer Look project, which Caleb started, could you give us a little bit of history of why you're here, how we met, what the deal is, and if you could share that with everybody, that would be great.
Yeah, so my name's Caleb Runyon. I'm a nurse practitioner specializing in dermatology as well as surgical critical care. And the first thing I have to say or ask is, how many of you guys have been affected by skin cancer? I can't see the audience, but I see two hands from our panel.
Yeah.
And my second question would be, how many of you guys get a haircut? Most of us, except maybe Bill or.
I feel like I'm bullied.
I'm sorry. So, what if your hairdresser could be the person that helps you identify a skin cancer before it becomes late stage cancer? That is a question that I asked myself in 2025, February of 2025, when my grandpa was diagnosed with melanoma stage 4. We believe the primary lesion started at his neck. And my grandpa is someone who is from Logan, West Virginia, does not like going to the doctor's office, as many of us don't as well. And I'll tell you, he always gets a haircut every 2 to 4 weeks, like clockwork. You won't see him without a shaggy head. And so I started to ask myself, what if his barber or hairdresser could have been the person to notice this primary melanoma on his neck? And so, I worked in dermatology at the time. I had lots of my patients coming in saying, my hairdresser noticed this spot. What do you think about it? And 8 or 9 out of 10 times, it was something malignant. So whether that was squamous cell carcinoma, basal cell carcinoma, or melanoma, or even a precancerous lesion, they knew something was wrong. They said something, and they prompted their clients to see someone and seek attention. And so for that time, I kind of tabled it. We kind of focused on, getting my grandpa into some treatments and seeing an oncologist. And during all of that, I started to think, we need to further enable our hairdressers and those in the community to be able to spot these things. And so I started this initiative called the Hairdresser Dermatologic Detection Initiative, which was a mouthful. And Bill had said to me, we need something that people understand, right? Like, people in medicine probably understand that, but most people don't. Let's simplify it a little bit and make it more available for community members. And I thought, yeah, you're so right. And along with that, personal care professionals started asking me, like, well, what about us? The massage therapist, what about me? I see spots. How can I help? Tattoo artists and makeup artists, all of these people started asking me, what about us? And so the Closer Look Project was born. And so this is a project that's near and dear to my heart. And we, at the Closer Look Project, educate and train personal care professionals to identify lesions or areas on the skin that are abnormal. And so, yes, the goal is to promote early diagnosis of skin cancer, but hairdressers are not diagnosing you. The whole premise of this event is, when you see something, say something. And that means if you see something that's abnormal, unusual, something you didn't see before, then you should speak up and say something, and it may actually save a life. For the Closer Look Project, I wrote a book, and it was published officially like a month ago. It's a 7-chapter workbook that trains these professionals. And we've really gotten a big response in terms of clinics accepting referrals from hairdressers. And we've helped get a few people in to see a dermatologist and get an early diagnosis and prevent what could be a fatal cancer. And so when you see something, say something is just that, saying something if something feels off. And so the way that Bill and I became acquainted, and Les Cancer became acquainted, his daughter Maeve, who's now a physician, she just graduated medical school. I know Bill's very proud of that. She and I were neighbors, and one day we were walking our dogs together, and I kind of told her my ideas and what I wanted to do with it. But here I am, little Caleb Runyon from Logan, West Virginia. I had no connections, nothing to, no way to support the mission, or so I felt. And Maeve said, "You should talk to my dad." I'm like, okay, why would I talk to Maeve's dad? And I find that he's the CEO and founder of Les Cancer, and we joined forces. And I think that Bill and I've collaborated with him on probably 5 or 6 events now, where you see something and say something, and it's just grown so rapidly, and it's been a wonderful project to be a part of.
Well, and I think too, part of this is it's been important for healthcare providers to be able to have these conversations with their patients that they know are in the business. And so if they're a hairdresser or manicurist, whatever, these are great conversations for them to have and to be clear about the fact that we are saying something, we're not diagnosing, we are sending them to a provider.
Yeah, many providers realize that hairdressers and tattoo artists and makeup artists don't have the knowledge or the assessment tools to diagnose a skin cancer. They're not going to be able to say, oh, this is a late stage basal cell carcinoma, but that's not the expectation. And I think many of us may get stumped on the fact that hairdressers may be asked to diagnose. That's not the case. They are encouraged to recognize and look into their scope of practice, and providers are just the tool that help bring that home when something is abnormal.
I want to share with our first workshop was in Logan, West Virginia, right?
Yeah.
And it was at your mom's salon. Can you share that?
Yeah, so my mom, so when I first spoke with Bill, we were thinking like, we're brainstorming, how can we make the most impact and where can we do this at? And we thought, why not host an event at a hair salon? And even further than that, my mom is a hairdresser and business owner and has been for 25 plus years. And so I said, what about Logan, West Virginia and my mom's hair salon? And Bill loved the idea. We set it up. It was in September 2025, I believe. We had an amazing impact and an outcome. We had tons of cosmetologists and nurse practitioners and physicians that came out to see, as well as the local community college cosmetology program. So the impact has been huge, and we're really instilling the idea that preventative medicine and practice is not only a healthcare professional's job, it can be anyone's job, and especially those that make people feel comfortable and seen. And I don't know about you, but my barber, every time I see her, my hairdresser, she knows all the details of my life, and she knows, what's going on. And if she told me something was abnormal, then I would believe her. And my mom, Christine, has been such an amazing advocate and support system for this. She spearheaded the program at her very own salon in Logan, West Virginia, and it's just been really an amazing journey.
What struck me about that experience was we had a community college, a nursing school, join us. And in Logan, West Virginia, part of the nursing school is a school for beauticians, which I thought was super interesting. And even more interesting that a dentist was the dean of medicine and also the school of hairdressing and beautician school. So I thought that was super curious, and we had a lot of different students packed into this hairdresser, which was fun. And one of the kids at the end, a student, said to me, I just had no idea I could make such a big difference in somebody's life. And I was like, speaking up is everything. And it often can save a life. So we are super grateful for your programming, Caleb. Does anybody in here have a question for Caleb?
Yeah. So how could we approach asking our local, hairdressers and beauty salons if they are kind of trained to look out for this stuff? And how do you suggest we go about that, but also connect them with you?
Yeah, that's a wonderful question. So I didn't really touch on this as much, but we'll get into it. The Close Look Project has a referral network program. And so we have partner clinics in 7 states, West Virginia, Virginia, Ohio, Maryland, Arizona, and North Carolina. And so typically what happens is the hairdresser or the personal care professional go over to our website and purchase the program. It's relatively inexpensive. And as soon as they complete that, they review the education, we connect, we sit down, and I find out who in the area, what clinics in the area are available, and I schedule meetings and speak with them, and I try to get them on board to accept referrals. And so if you wanted to get your hairdresser or your personal care professional to join this program, they would just have to check out our website at closerlookproject.com.
Okay, I think if it's okay, we will stand by, Caleb. You know what I wanted to do before we move on? Eric, we have a demonstration that Caleb did. Can you pull that up so we can see that?
So a big consideration as well with, can you hear me okay? Okay, is how do you even do a skin assessment, right? And not that I want you guys to be proficient with a skin exam or a hairdresser to be proficient with a skin exam, but just knowing like what areas are concerning, which areas require a bit more attention, and what areas are more exposed to the sun, which areas are missed with sunscreen application. So those are the things that I want to kind of focus on today. Ali, I'll have you remove your glasses if you don't mind. So I always start out with a view that kind of just takes a look at my client's face and seeing anything that I, straight away what is concerning to me. And so, I'm not trying to diagnose him today. If there's something suspicious, I'll likely talk to him afterwards. But looking at the face from a whole perspective, that kind of gives us a micro assessment. And then we know where to zoom in on. Okay, so typically I'll start from the side and kind of work my way around. And so which areas would be the most concerning for men especially? Well, I would say the ears, behind the ears, and the scalp. A lot of us are thinning up top, myself included, and so I forget oftentimes to put sunscreen there, and I'm sure that you do as well. And so that is an area that the sun has direct view of all day long that you're outside, or if you're driving or whatever. So that's an area to be mindful of. Behind the ears and in the ears, in that conchal bowl region, that's another area that's concerning. So I typically will start on the side here and just take a quick look. Now, you see, most of us have these kind of like lines here, laugh lines, smile lines, wrinkles, whatever you want to call them. You always want to kind of take a little bit of a deeper look there. Good. Great. So, this region here is getting so much sun exposure, right? So just something to be mindful of. And if you have a wide part, if you have blonde hair, if you're bald, these are things to consider, because sunscreen, you probably aren't putting it there, right? Who thinks about that on their head?
And Caleb, what are you looking for? Certain
Yes. So
what do you
So I'm looking for anything that's different from his skin tone. So, he has an even skin tone here, but if you see something that's darker, for example, here's a little maybe ingrown hair or something there that's a little darker. I don't know if you can appreciate that on the screen, but if you start to see something that's discolored, if it's ulcerating, if it's bleeding, if it's itchy, those are abnormal signs, right? How many of us have itchy spots all the time? You shouldn't, by the way. So those are areas that you should probably check in on. So that's what I'm looking for. Any indiscrepancies with the skin tone there? Good question.
And when do you do this kind of exam, Caleb?
So with these exams, I typically will start, like in clinic, we do these once every 6 months, once every year, for hairdressers, I think it was, someone mentioned that your wife goes to the hairdresser twice a month, right? And for a lot of women, my mom included, do not touch my hair, do not touch my scalp, but her hairdresser's got her hands all in there, and she's very happy to have that. And so what a better time to take notice. And you don't have to even be, you don't have to announce, oh, I'm parting the scalp and parting the hair and looking at this scalp. I'm looking at this spot. I'm looking behind the ear. Just be mindful and just kind of just take inventory of what you're seeing.
Yeah, Caleb, and I would just add, I think one of the other things about those of us that go to the same stylist is that you'll notice if something has changed. So it's not
Correct.
just the one time.
It's not just the one
over
time.
time, there may be something that's growing a little bit larger, or maybe changing color or shape.
Yeah. So if I see his scalp today and I see it again in 2 weeks, if there's a spot that I don't remember seeing before, well, I'm gonna speak up and say something to him, and possibly recommend a referral to a clinic. So that is basically the scalp exam. It's pretty simple. Like I said, I don't go into the weeds on this, because what will you benefit by knowing that the top layer is the epidermis? Nothing. You're not going to benefit from knowing that. So just knowing that if something looks unusual, you should say something. Okay.
Also, too, I just want to bring up, but we did this when we did this workshop in West Virginia. We talked about nail technicians and we talked about tattoo artists. We had our candidate then was a bald man covered in tattoos, which is more challenging. And he was a barber, and was he also a tattoo artist?
Yes.
Yeah. So he had a lot of skill sets there, but it was interesting because we were talking to nail technicians, and on black and brown skin, we see a streak in a nail or a spot in a nail, but you say something, you send them somewhere, but there's this opportunity to say, do you want me to paint this nail? Do you want me to paint this now? Are you going to take this nail off? Are you going to take this polish off when you go see the doctor? So those are the kinds of conversations we were having, and super successful.
Yeah.
We had a whole cosmetology school at that event. It was interesting.
Yeah, it was.
So thank you, Ollie, very much. I called Ollie to see if he would be our lab rat, and he was so willing. And we're so grateful for Ollie and the great work that he does here in Warrenton. Okay, good. Thanks, Eric. And that was a good demonstration. Any questions, comments about that you wish to ask Caleb about? Go ahead, Courtney.
You mentioned something about blonde hair. Are there certain hair colors that are more susceptible to skin cancer?
Yeah, that's a wonderful question. So when we think about risk, there is something that traditionally most providers go by, and it's called the Fitzpatrick skin scale. And so basically it looks at your skin tone, the color of your eyes, your history, your hair color. Now, if you are someone who's born with red hair or blonde hair, then your risk is much more, it's more significant because you likely also have pale skin and perhaps blue or brown eyes, and these things make you a higher risk. If you are someone who colors your hair blonde, for example, then your risk increases because you then have less darkness that absorbs those UV rays, as well as your hair your scalp is more susceptible to those rays as well.
Question. Thank you for that, Caleb. I think if we don't have any more questions, our next person we want to talk to is Dr. Pessold, who's come to us today from Utah. That's okay. We're all set. We stay with us, Caleb, if you can. Thank you.
Thank you guys so much.
No, thank you very much. Tricia Petzold is also the chairwoman of Less Cancer. And Tricia, can you share a little bit about your journey, what you do, and tell us a little bit about that?
Sure. I'm trained in family medicine at the University of Utah, and I've stayed in Utah for the last 26 years with my career. And the first 18 years, I was an emergency room physician. Back in the day, that they didn't have a lot of emergency residencies. A lot of the times, the family practice docs would take that role, and that's what I did. And then around 2018, transitioned to practice more of preventative medicine, focusing on well-being, optimizing people's health, and started to teach that topic of prevention and well-being to the medical school students. And the last 8 years, that's what I've been doing. Courses like food is medicine. There's a culinary medicine course that I teach, and it's actually a cooking class in med school. It's like the most delicious class in the whole med school. But also a 4-year curriculum program that allows students to not only learn to identify disease and treat it, but also to create environments for healing and connect with patients and look for a deeper approach to prevention. And so that is where I've been focusing. Similar time getting involved in Less Cancer and really feel like the two roles are very much in line and support each other. I think one of the greatest things I noticed is at the time seeing one patient at a time was my main job, and then to meet Bill and find out he's going down to Capitol Hill and talking about policy and reaching out to communities and connecting with larger groups of people was really in line, I think, with who I wanted to be as a physician, and it really felt like it was amplifying the message I was trying to teach in the medical school. So it was a great opportunity for me to join and volunteer for Less Cancer. I didn't know he was going to rope me into being the chair of it, but
it happens.
Yeah, it's been joyful, and I've enjoyed the evolution to these off of Capitol Hill into communities like this. It's been really wonderful because really connecting with people is rewarding, and I think more maybe effective in a different way. So
the one thing I think Tricia is exceptional at is listening, far better than I am. But when it comes to people's health and their concerns, they often are not heard. And so when we have experts in the area that can address these issues, it's transformative. And it also brings type of literacy to a patient, so they too can be empowered to ask questions. And I think, when we talk about things like the social determinants of health, who we are, what our gender is, where we live, how much money we make, when all those things come into play, it's not all the same for everyone. And so community can support these in a very unique way. We can all support each other in a really special way this way. And I just wanted to say thanks for all you do, because it's important and transformative.
Thanks. Yeah, I think one of the communities I'm part of is the Snowbird Ski Patrol, and I work in a clinic there. But we do quite a bit of prevention for employees, and we'll do skin checks periodically in that community setting.
Tell us about that. In your role in the emergency room, if you happen to have somebody come in with a broken arm, I know that physicians are trained to look at the whole picture. Tell us about, if you happen to see a skin lesion, what that might look like, or how that might get to the next step.
Yeah, that's a good point, because someone with a changing skin lesion may not take the time to go see a doctor, but when they break their arm, they're right there in the emergency room. And so it's a great opportunity to kind of do a scan, ask if there's something else that they notice is, going on. But often it's the nurse or the physician who sees it and is able to say, this doesn't look right. Where did this come from, and how long have you had that? And then typically it will be, depending on the emergency room situation, if we can do a biopsy and get some information, we'll do it right then. In a more stable situation where we think the patient will come back, more typically we'll get them to a primary care doctor who can do that, or a specialist if that is available. Depending on where I've worked in different ERs, that is sometimes available.
Awesome. I often think of the patient myself and people like me, when you're in somewhere and they might ask you about something else, like a lesion on your ear. You're like, oh, I'm okay. That's all right. So, these providers are really challenged with them getting to the next steps, going, it doesn't look so right. And then do you ever biopsy if you see something in the ER? Do you ever say that needs to be looked? What does that look like?
Yeah, we will biopsy, and if, like I said, if there is, the person has an established primary care doctor, we'll often have that person do it, because then the follow-up is much more secure.
Right.
And that's the risk. But usually if there's concern that they won't follow up and take it seriously, and they're willing to do it there, we could biopsy you right there in the emergency room.
That's great. Does anybody have a question for Tricia? Anything come to mind that you were thinking? Go ahead.
I know at certain times people, if they're in the emergency room, they want it to be an in and out situation. And you're worried about them not treating, taking what you're suggesting seriously. How do you try to get them to agree to biopsy?
It's a good question. They did a study that if you, as a physician, walk into an emergency room, patient room, and you only have 10 minutes, and you sit down and talk to the person at their eye level, versus only spend 10 minutes with them, versus the people who came in, spent 20 minutes but never sat down. The patient response was the physician who sat down was with me longer. So I think it's how you build a relationship even in those 10 minutes, finding out who, asking questions that are open-ended and being approachable. And some people you'll connect with and some people you won't connect with. Some people are willing to, if someone feels heard and they trust you, then they might feel secure doing it because they feel like I haven't had this relationship with a doctor before. But it doesn't always, I can't convince everybody. And it is, everyone has the autonomy to choose to do it or not do it.
I think an ER is a real opportunity.
Yeah.
Not everybody, a lot of us will put doctor's appointments off or cancel stuff. But if you have no choice and you're there, I think, in my experience, ER providers are the ones that do the big view. They understand you're here. You may not be here again. You may not be going to a doctor's office anytime future. I gotta take it all in, right? Is that pretty much it? So our next, thank you, Tricia.
You're welcome.
And thanks for all you do, and thanks for being here.
You're welcome. I told some of you that my family's in Michigan and I'm from Michigan, so I love coming here.
Yeah.
And Traverse City is a special place in Michigan, so thanks.
And she sends everybody to Munson, by the way, including her family who live far away. So we're grateful.
Yeah, we
for
come
all
from
you do.
an hour and a half to come here. We
Yeah.
love it. So.
So, Bill Rowland,
Hello.
thanks for being here. We're so grateful to have Bill here. Bill is a physician. He is a DO. We have a dean, actually, from a DO school on our board, from the A.T. Still School. And Bill has been participant in these panels and with Less Cancer for several years. He, in my mind, does really transformative work here in Traverse City, and has connected with a variety of demographics from all scales, all places, all, from super rural areas to not as rural areas. And can you tell us a little bit about what you do, and also a little bit about the street medicine, all of what you do?
Absolutely. Well, it's great to be here again, so thanks for the invite. So Bill Rowland, I'm a Northern Michigan native. I grew up in Cadillac, 45 minutes down the road, and was fortunate going to Michigan State Osteopathic Medical School. I've been able to stay in Northern Michigan pretty much my whole career. Did my training up here for clinical medical school years and then residency. Spent a few years in a rural community in mid-Michigan before I came back in 2002, and now I direct the residency. So residency, medical students graduate, they choose their specialty. We have a family medicine residency at Munson. It's a 3-year program. And our residency, even though Traverse City proper is not necessarily rural, we got a lot of rural areas around us, and our mission is really to train our family docs to do full scope medicine so they can go out and practice in areas that are more underserved, more rural based. And dermatologic issues are really important in that, because a lot of the communities our folks would go to, there aren't dermatologists around. So across the country, there are certainly a lot of family doctors that kind of see patients, you've got something, I'm going to refer you off. I mean, we're trying to do more of, we're going to sort of see, hopefully diagnose and manage about 90% of what we see, and then get appropriate consultation when we need to. So to Bill's point, our clinic itself, a residency clinic, very much serves a population that's in need. For example, even today, probably 25 to 30% of the folks we see every day either have Medicaid or they're still uninsured, despite all the Affordable Care Acts and all those things. What we've just found out is that even though everybody's supposed to have insurance, many can't afford their insurance, so they just go without. And then to Bill's point about street medicine, so we collaborate with multiple other entities in town to do homeless outreach street medicine, which is really blowing up since COVID. And we've gotten a number of grants to kind of expand the footprint of that beyond Traverse City. We go to Cadillac, we go Cadillac, Beulah, and then east a bit up to Mansalona. We're looking at Gaylord. And so this gives us an opportunity to touch folks that if they're unhoused, also have even further lack of resources, further connectivity to any kind of primary care, and see if we can meet them where they're at and then try to provide care. So that's the kind of the benefit. And then we do full scope training. So I still deliver babies and take care of people in the hospital, all those things. So,
which is key.
Yeah.
I think everybody, I don't want to make this assumption, but when people are unsheltered or unhoused, and they're facing different challenges, their health inevitably is less. So the success of those people that are struggling with diagnoses like cancer often are not good, and the outcome is not good. So Bill's work is very special because in some cases he's dealing with some of the most extreme cases, the most extreme circumstances. And so, Bill, maybe you could share like a day in your practice or a day in your office. Somebody comes in for a cold and you happen to see something and say something. What's that scenario look like?
absolutely. Well, given that we do full scope, and that's some of our residents' challenges is, their mindset is, well, they come in with a cold, I want to deal with a cold. But if they come in with a cold and they're doing a head and neck evaluation and they see a big weird looking skin lesion somewhere, that's sort of like the oh crap moment. Now I got more to deal with this particular patient, and that's certainly what we want them to do, to at least say, if you see something urgent like that, potentially urgent, then this may be the only, it's been alluded to already, the only time the patient's coming in because they have an acute issue. And many folks are still delaying preventative care for a variety of reasons. Life is busy, but things are costly. And in the situation of being unhoused, or if you're in a more of a socioeconomic sort of risk or less means, prevention goes down your priority list. But so in that setting, if we saw something that was unusual during that acute care, we need to evaluate that right then, make a decision. Is this something that we need to biopsy right now? Do we think the patient would come back in short order for a biopsy? And then that would be how we approach that, is let's biopsy it, try to get a diagnosis, and then decide what's the appropriate treatment. Some of those things we might be able to treat ourselves. There are certainly some more superficial skin cancers that we can do the excision, we can do the definitive treatment, and then many others that we'll need to refer for.
I don't know if you have any dermatologists up here, but in your family practice, do you do regular skin checks for people?
I do. So, we try to practice evidence-based medicine.
Yeah.
And one of our resources from a prevention perspective is the United States Preventive Services Task Force. It's kind of like the governmental agency that says, here's what we'd recommend you as primary care providers, level A through D evidence. Is this good to do? Is this not worth your time to do? When you think about screening, something that's a valuable screen is that it's cost efficient, and you're likely to find something early enough to improve mortality, to improve death, to improve morbidity, those kind of things. So the interesting thing is, you would think that a head to toe skin exam every year is like, that's a no-brainer, right? Well, that's an I recommendation, meaning there's really not enough, evidence for or against. Counseling children up through early adulthood on sunscreen, there's evidence to support that. So we do a ton of counseling. I still do a skin exam, and at the very minimum, and sort of to Caleb's example, I try to examine places that the patient won't see. Their backside, their buttocks, maybe the back of their scalp, the back of their ears, and I kind of bake that into my preventative visit. And we certainly teach our residents that that's really somebody, I think it's a fair thing to be looking at those visits, to because hopefully if other visible skin to the individual or their loved ones, they would speak up if they saw a change. But you're right, you can't always rely on that, because it's amazing what people will ignore.
And it's tricky too, because like when you're my age, for instance, a lot of my friends' ears are getting chewed up from skin cancers, from a variety of things. So, the bucket hat or something that goes over your ears is super critical for that sort of thing, not just a hat. And I myself am not very good with sunscreen. I might do this, and this head will be burned. This side will have a white patch on it, but we're not as careful as maybe we should be. So if you use a multitude of things at lower risk, like clothing or hats and sunscreen and docs, and doing the skin check is key. And obviously things like indoor tanning, bad idea. And Michigan, actually, I think now you can't be a minor here, if I'm correct, to use them. And Less Cancer was involved with that effort several years ago, which is, great. Anywhere we can lower risk is a good idea. Anything else you want to share on that? And does anybody have a question for Dr. Rowland? Anybody?
I think how do I want to say this? I think publicly speaking, even though there is certainly attention to skin cancer, I almost feel like the skin still doesn't get the respect, or there's the misconnection or misunderstanding that I think folks still kind of take their skin for granted, thinking that, well, if there's an issue, it's going to jump right out at me. Or no, I'm not going to be affected by this, but especially at a young age, because we all know that it's the cumulative sun exposure. And so it's the sun exposure that my 20-year-old daughter right now is obsessed with, and she's tired of me being in her ear about this. But this one's going to get her, later potentially. But also earlier, the rise of diagnosis of melanoma in young individuals is significant over the last several years.
And 30 years old, like young.
Yeah, young people, right?
Yeah.
Young people. So I just feel, and then all the attention to aesthetics and beauty and all the things that's out there, I almost think we get a little bit blinded by that. And then the obvious thing is protect yourself, sunscreen, all those kind of things.
I think you bring up a really important observation about skin not being the priority that maybe your heart might be,
Right.
or maybe, and maybe it's not as much of a 911 all the time, but it's a significant priority. Your skin is your largest organ, right? Am I right? And
It is.
And there are lots of places for damage to occur, and anybody that's been through melanoma knows how horrible that surgery can be and how significant it can be and far-reaching. And so these are super serious issues, and I think that the fact that, or that observation that skin doesn't seem to be as prioritized as other parts of our body or ways we live or where we live is a bad mistake.
Yeah.
And that people really need to take that on with all the seriousness and intention as possible. The other thing I wanted to mention about both you, Bill, and you, Tricia, is that the type of practices you have, the private practices you have, you are deeply involved with people's lives. You know their stories. You know what they're going through. You know what they need. So when you can have those relationships with physicians, which is harder to do these days, it's life-changing for them. I mean, their health is already, their outcomes will already be better because they have engagement with both of you and as patients. And it's not always like that now. People have to wait a long time sometimes to get treated. So the relationship and connection that we have with our physicians or providers is everything. We have, I'm not done yet, but we have, go ahead, huh?
Yeah. No, good.
Yeah, we have a hairdresser here.
Yes.
And can you tell us a little bit, please share your name and tell us a little bit about your practice and what you do.
So my name's Martina, and I own Epiphany Downtown Salon and Spa. And I've been doing hair for probably over 40 years now, probably about 40 years.
Wow.
And I have found cancer on people before. I've found spots and have watched them. And then the next month they've changed. So then I've sent them directly in to be checked. And some of them have been cancer, some of them have not been. But I'm always watching for signs on people. And I try and get all my hairdressers to watch, and my massage therapist and my facialist. And
Good. Well, we are so glad you're here.
Yeah.
And thanks for being here. It is hard for folks to get away during the day with clients, especially on a weekend. It's tough. So thanks for being here. Do you have any specific questions for either Dr. Rowland or Tricia?
If maybe Dr. Rollins, if we have someone come in and they don't have someone to go to, can you be a good referral?
Absolutely. I mean, the family practice center, the residency clinic that I direct, we're wide open for new patients, and we're mindful about the acuity of a new patient request. And that's one of the things we'll kind of triage. Is this sort of somebody who's just trying to get established for preventative, or hey, do you have an issue that may or may not be more serious, and how quick can we get you in? So absolutely, and there's a few other clinics around town that are certainly open to new patients, but absolutely.
I've also had people from this area call me and say, I can't really tack down a dermatologist. I can't get in without a referral. I love the fact that people can call the family practice directly and just get in there, and that they're wide open for new patients. This one person ended up driving out of town, I think to Ann Arbor, and this is a great health hack, knowing that there's somebody here and that they are able to address this issue, and if not address it, refer it up for further care.
And I would say that is still a potential gap in our community. Medicaid or uninsured, if you needed a dermatologist, it's tough.
You can't
get in. We're lucky that we at least have a plastic surgeon that's employed by Munson, that if it was more of I saw a mole that needed excision that I couldn't do, we've got a plastic surgeon we can refer to, and it's appropriate for like a melanoma where you need to have a bigger cut around that potentially devastating skin cancer. But that's still a gap. But we can at least get people plugged in, hopefully get some diagnosis going, and then figure out where to go from there.
No, which is key. And I have somebody in my world that I kept suggesting, hey, you may want to get that shoulder looked at. Yeah. Nobody listens to me, right? Just like nobody listens to anybody in their house. And so, but the surgery, significant from the shoulder to below the knee. I mean, just crazy amounts of surgery. And so this is why when you have somebody like Dr. Rollin in your community, you can at least get in there. If it needs to be escalated beyond him, he can do it, which is such a gift to Traverse City. So thank you. And obviously Tricia can too, but Tricia is in Utah. Yeah, and that's harder than getting to Ann Arbor, right?
Yeah.
So, and I was thinking just with you here, I mean, the number of salons in Traverse City and the number of massage therapy in our Traverse City and the number of tattoo artists in our little community, it's
manicurists,
pretty sizable.
Yeah.
So it would be interesting to take a step forward and try to organize more of a community-wide event, and then have, a healthcare provider come.
Less Cancer would
would be pretty neat.
Great idea.
Yeah.
We would love to be part of that in any way we could. Also, too, it was, when I was learning a little bit about fingernail beds and lesions in fingernail beds, I thought to myself, there is not a woman anywhere, or a man, I guess, that's going to invest in a manicure and then take that nail polish off to go see their doctor. So in that earlier conversation when we were talking about screening, if there truly was something on the fingernail bed, we might suggest to a manicurist, hey, encourage them to hold off till they can go see a Dr. Rollin or a Dr. Petzold, or, and because it's one thing to refer somebody, it's another thing to maybe give them next steps, which you're not expected to do if you're in the beautician business. But if you do see something like a lesion on a fingernail, you might suggest, hey, let's wait, come back after you see the doctor and I'll paint this, or just some kind of pivot that will make sense and make it easier and more convenient for your client. Obviously, you can't diagnose, but you sure could send them out the door to a provider.
Yeah.
I just wanted to thank you guys. Is there anything that we need to wrap up here, or anything that you wish to share before we leave?
No, I guess the last thing I would say, in the skin focus, but it ties into overall healthcare as well, and it ties into prevention of anything, but especially cancers. I mean, despite, again, I think a lot of attention nationally about cancer prevention, there are still a lot of very passive people out there who are not proactive about their health. They, decline their cancer screenings. Even when they come in to see me, they decline, whether it's breast cancer or prostate cancer or colon cancer. So I think the more that, again, sort of see something, say something, the more that, people can be reminded by others, maybe not their healthcare provider, but by other loved ones, that, hey, go get that prevention done. Eventually, I think maybe people wear down a little bit and they come in.
I think skin too is an
Yeah.
easier transition. Like,
Yep.
yeah, it's tough to talk somebody who's not having a colonoscopy into a colonoscopy. But, you know, when they get this idea that, you know, an easy once over with an eyeball, what's the problem? And it gets them into that access literacy. Let's go ahead. I'm sorry.
Yeah, so I actually had melanoma 2 years ago. And when I first called, they were really busy and I was going back to school. And they put me on Zoom. And then I showed them the spot and they said it was safe. And my mom was like, I don't think they're right. So we had to go in.
Yeah.
And we found out it was melanoma. I had to get nodes and all that removed. But sometimes I think doctor's offices like makes it harder for you to actually get there and get the proper concern across.
Sure, no question. I will tell you that I absolutely hate rashes over Zoom. I mean, and we get that a lot, or even over phones. I mean, how many times does somebody send me a picture of something? I'm like, I'm sorry, I can't do anything with that.
Yeah.
I mean, it just, you lose a lot as opposed to the in-person. Now I can touch and I can see and I can touch, no matter how good the resolution is on these phones or the Zoom connection. But you're right. I think that elevates to what's some of the problems with our healthcare system in general. Just our whole healthcare model, access to care, what offices are driven by to stay afloat financially. I think that impacts sometimes something just like that. That looks fine. I mean, we've got a medical student recently who had, when I heard about the lesion, I never would have guessed it was melanoma. And it was. And, fortunately, it didn't go away. And so her primary care said, let's just biopsy it. It's going to be nothing. It wasn't nothing. So, and I think that's where, and for us as healthcare providers and physicians, I mean, I think I biopsy a lot more just because it's just like that. I mean, sometimes you're fooled.
Yeah.
You're just flat out fooled. So.
Also, too, it's so hard for people to get into their provider's office in many cases. Mm-hmm. And so, I think the Zoom thing was a bit of a Band-Aid, but yours was post-COVID, after COVID, yeah. Correct? And I think there are some offices that will accept that as, how much of a 911, but they're unclear with saying that. They may want to see you on Zoom to make sure you can sit up in a chair and communicate and do some of those things. But by no means is it, thank goodness for your mom. And thank goodness that she pushed it. But I think some of our communicators and healthcare providers' offices miss things occasionally. And when we have a problem with healthcare, it's often at the front desk. Not to throw them under the bus, but there is a lot of things that they are juggling. Yep.
I like what it reminds me of is our need in our society for patient advocates, and your mom was that role in this scenario, and it's phenomenal. But I often think that we should have. Our healthcare system should have a new job for retiring nurses, retiring physicians, retiring healthcare specialists to have some kind of an advocate for patients. So there's a kind of a liaison. So when they get the message, it's no big deal. They don't just go on their way and feel like that's final. If it's no big deal, great. But if there's something that doesn't look right to somebody else, and I love the idea of taking the community here and getting more self-care businesses linked in with a direct chain to something like the residency. I mean, it's really a neat concept, but yeah, it's a lot about communication.
Mm-hmm. I think so much is about communication, and also, fortunately, I think culturally, and we've been part of this movement, is to provide space for people to discuss their concerns without being judged negatively. And I think for years and years and years, people were hesitant about talking about what bothered them. And I wrote an article recently about Mary Lincoln, and the people that diagnosed her were, beyond the fact that none of them were women, they were men without any science background in psychology or a lot of other issues. And I think the reason that concerned me is because I see people every day, or I hear from people, many women who say, I don't think my doctor heard me. I don't think I was heard. I think they think I'm a nutcase. And that's unacceptable. These guys wouldn't be like that unless you truly were off your mind. But they're not like that. And I think a lot of times we see people that write people off. They make assumptions when they don't have the information to fill the gap. They don't have the science. They don't have the evidence. Assumptions are made, and that's just not healthcare.
I find a lot of people come in and they're on their guard, and they want to make sure, they've been so conditioned to know that they only have a few minutes. They want to get them as much information out, and a wall is sort of built, like, oh, I don't have time for all of that, and once a active listening experience happens, the person lets down their guard a little bit, and then the conversation feels more rational, more, I see your concerns. I know, I see why you're doing this. And I think sometimes that is part of our miscommunication in the healthcare system.
Right. And it is, it's that, and two, who's asking the questions. Often we will be checking, not often, but when we've all been in the emergency room for whatever ailment we've had, there's this whole checklist. Is somebody beating you up at home? And it's usually by a person that's trying to get through the checklist to get to the next room, and you end up saying no to everything just to keep the wheel moving. And so some of these practices are well intended, but how they're communicated, where they're communicated, is a missed ship. And that doesn't mean we break or stop healthcare. It means we just keep working towards it. And the best prevention tool, I believe, is communication. And these conversations and our observations, they all mean something. And so I don't, to that point, we love these guys, and we're so grateful to have them here today, and grateful to have you. This will be streamed into many communities after today, and a lot of people are going to be part of this conversation, and they will be reaching out, and we'll hear more about it. So thank you both for being here. Thanks for your leadership in Traverse City, and of course, Tricia, our chairwoman, and leadership in many communities. So thanks for everything. Do you guys want to share anything or say anything before we?
Well, thanks for having Less Cancer here, and thanks for always the warm welcome in Traverse City. I can't get over it. I love it. And hopefully you're available tomorrow to listen to some music at noon, and we're going to celebrate our next move, which is spending the month of June being physically active, just getting out, walking, hiking, going on a bike ride, connecting to community. And so with sunscreen on and a hat and a shirt, and we might need an umbrella tomorrow. I'm not sure. Hopefully,
we might in the morning, but not all day.
Probably not during the concert.
It is awesome. If you have not been to the Less Cancer website or seen the landmark Less Cancer Hike and Bike America, please register. It's super easy to do, and it's free. And you can make it your own journey with your own family, with your own friends, with your work. We have, into the hundreds now of participants, and from over 20 states. And we talked about this last night. I wrote something this morning. But when we can connect with community, we're better off, always. And now so many of us are connected digitally. We don't have the opportunity to really connect with community. This is one of those opportunities we were talking about in the olden days, when you didn't see somebody at the diner, the corner diner, or you didn't see them in church. You knew there was something bad going on, and you could check in on your neighbors. You could see how they were doing. You could eyeball them physically in person, not over Zoom. and be able to care for your neighbor. And that's how we lift up public health. That's how we lift up cancer prevention. That's how we do a lot. We do it together, all of us together. And we do it under the umbrella of evidence-based science and medicine, and not like shoot from the hip, at my next yoga class. We're so lucky to have these people that have devoted their lives to making each of us healthier.
And by signing up, it's free, but it sends a message that this community and prevention matters. So
Right.
tell all your friends, jump on and
Just signing up lets everybody know our work matters and is very helpful. Thanks for being here.
thanks.
Thank you.